In this video, we will go over some basic terminology that you will undoubtedly hear thrown around while on your orthopedic rotations that I feel would be helpful to know. I know that I have sometimes used these words in my videos and have received some feedback that a quick overview video might be helpful for those earlier along in this journey. I will keep this as concise as possible per usual, so let's get right into it. Let's start off with varus and valgus. These two terms are used to refer to angulation in the coronal plane. Varus has apex lateral with the distal component more medial in comparison to the proximal component, and vice versa with valgus, the apex is medial with the distal component being more lateral. This drawing helped me early on when trying to remember varus versus valgus, so just dropping it here. Next we have procravatum and recurvatum. These terms refer to angulation in the sagittal plane now. Procurvatum has apex anterior while recurvatum has apex posterior. You can see these here. Next is dislocation and subluxation. These words are used in reference to joints. Know that for shaft fractures, for instance, you would use displacement when talking about any change in alignment. So back to dislocation, this refers to when the two bones that form a joint no longer have their articular surfaces in contact with one another. Subluxation, on the other hand, is used when referring to a joint that is not completely dislocated, so the two bones forming the joint still have some articular surface communication. You can see examples here. Next is sprain and strain. Sprain refers to the stretching or injury of ligaments, which of course connect bone to bone, whereas strain refers to the stretching or injury of tendons, which connect muscle to bone. Lastly, malunion versus nonunion. As we talked about in a previous video, nonunion refers to a halt in fracture healing in which, without intervention, the fracture will not heal. Malunion, on the other hand, refers to a healed fracture that healed in an abnormal position. So this could be incorrect anatomic length, alignment, or rotation, or a combination of the three. This X-ray here is a good example of both, with the radius demonstrating a malunion and the ulna demonstrating a nonunion. That is all for this one. See you all in the next one.